Thank you, Mr. President. I rise today to speak about the Medicaid program, a program that I'm sure a lot of folks in Washington and around the country hears about a lot, and we talk about it a lot, but I'm not sure people around here have a real sense of what it means to folks back at home. Medicaid is a program that's 50 years old, more than 50 years old now, and in some ways the name doesn't convey the scope of it. In some ways I wish it had a different name because it would remind people who benefits from it. If you instead of referring to it as a Medicaid program, if you called it the Kids, Seniors, and Folks with Disabilities program or something like that, you'd be accurately describing the scope in the reach of the program, because it has a profound impact on the lives of children, on the lives of older citizens trying to get long-term care in nursing homes, and of course it has a huge impact on individuals with disabilities. We know that in the campaign, President Trump made a statement, and I'm not quoting him exactly, but it was a brief statement during the campaign, and it was in writing, that he would not cut Social Security, Medicare, or Medicaid. I think a lot of people have forgotten about that third one. And one of the tasks that we have in the Senate is to make sure that when a statement like that is made, that any president is held accountable to that promise. The examples I could cite are many about the impact of Medicaid. Just a couple are significant, not by way of exclusion, but I'll just mention a few. I'm holding here a document, a March of Dimes document, an issue brief by the March of Dimes, and it's entitled Value of Medicaid. I won't read it all, but here's just one that I'm not sure a lot of people know. Medicaid, and I'm quoting, quote, Medicaid covers 45% of births, 45% of all births, unquote. And they have a footnote for that. I'm not sure there are many in Washington that know that. That's why I referred to it earlier in a more informal way, the baby program, because all of those children come into the world paid for by Medicaid. Medicaid has a substantial impact on rural families, rural America, rural hospitals. By one estimate, a couple of years ago, First Focus, one of the advocacy groups here in Washington that tracks issues that relate to children, estimated that as of 2012, and I doubt it would have changed much since then, as of 2012, more than 45% of rural children got their health care through Medicaid or the Children's Health Insurance Program. So almost half of rural children benefiting from one program or the other. Just a couple more. 1 in 5 seniors receives Medicare assistance through Medicaid, and that includes premium assistance, cost sharing, long-term care, dental care, and vision care. Another important number, 2/3 of nursing home residents are covered by Medicaid. I mentioned children before and the profound impact it has on their lives. Medicaid covers 40% of all children in the country. I mentioned CHIP and Medicaid combined covering almost half of rural children, but just Medicaid alone covers 40% of all children, rural, urban, and everywhere in between. And if you just consider low-income kids or children that come from low-income families, Medicaid covers some 75% of those children. So there's a lot to talk about, but one issue that's been joined now, or we're in the process of engaging on an issue, is what will happen to Medicaid. Despite what the president said when he was campaigning, and I'm talking specifically about Medicaid, just this weekend, the administration announced, without much attention drawn to it at the time, but I hope increasingly more attention, that the administration would support block granting Medicaid. That's at variance with what the president said. In my judgment, a total contradiction of what he said, and now apparently his administration has embraced the House Republican approach to Medicaid, which is block granting. There are a lot of ways to measure that, measure the impact of block granting. One, and I'll just cite for the record, Mr. President, I'd actually like to have this made part of the record. It's a report by the Center on Budget and Policy Priorities, dated March 15th of 2016, entitled Medicaid Block Grant Would Add Millions to Uninsured and Underinsured. And I'd ask that that be made a part of the record.
Without objection.
One of the headlines of that, one of the basic conclusions by a respected organization that tracks this information, I'll just read that headline. The block grant, quoting them, the block grant would cut federal Medicaid funding by $1 trillion from 2017 to 2026. So if you're saying you're going to protect children and you're going to protect seniors and you're going to make sure that those with disabilities don't have any problems going forward, it's pretty difficult to do that if you take $1 trillion out of the Medicaid program over the course of a decade. There was an op-ed in the New York Times on Christmas Day, interestingly, that it actually was printed on that holy day. An op-ed by Gene Sperling. Gene is someone that many people in Washington know, but for those who don't, Gene served two presidents and served both presidents, both President Clinton and President Obama, as the director of the National Economic Council. One of the conclusions that Gene reached, based upon his research and his vast experience, I'll quote him directly from the December 25th op-ed in the New York Times. And this op-ed was entitled, "The Quiet War on Medicaid." And I'm quoting, quote, "Together, full repeal," and there he means full repeal of the Patient Protection and Affordable Care Act, "full repeal and block granting would cut Medicaid and the Children's Health Insurance Program funding by almost $2.1 trillion over the next 10 years, a 40% cut. So whether you look at it in terms of block granting's impact on Medicaid, or the combination of the block granting policy, which the administration has now embraced fully, and the repeal of the Affordable Care Act, the result of that is you adversely impact two programs, the Children's Health Insurance Program and the Medicaid program. So let me bring this back to real people. I just want to highlight a couple of excerpts from a letter I received recently, and then I'll conclude. This is a letter from Coatesville, Pennsylvania, in the southeastern corner of our state. A letter sent to me by Pamela E. Simpson. I'll just call her Pam, even though I don't know her personally. But she wrote me a letter about her son, Pam Simpson's son, Rowan. She said that Rowan, I guess, is now 5 years old, and back in 2015, he was diagnosed with autism spectrum disorder. And she went on to say how much Rowan has benefited from the Medicaid program. We call it medical assistance in Pennsylvania. She said that among the services he received was the behavioral specialist consultant helping him, and a therapeutic staff support worker. Direct help, direct intervention, so that Rowan can grow and benefit from those direct services. She said that the agency that administers these kind of wraparound services for Rowan and children like him, in this case is called the Child Guidance Resource Center. And they started a particular program focused on social skills, especially for children with autism. But here's how she concluded her letter, and this is why I want to cite it in the context of this critically important debate we're going to have about Medicaid and the question of block granting, which sounds kind of benign, doesn't it, when you say it? It doesn't sound that bad, but in my judgment would be devastating to these families. She said to me in the letter quote, "Please think of my dear Rowan and his happy face, his big blue eyes, his lovely strawberry blonde hair." And you can see it in these pictures that I should have mentioned earlier. Rowan in 2 different pictures, and they're dressed as a firefighter. Please think of me and my husband working every day to support our family. And please think of my 9-month-old daughter, Luna, who smiles at her brother daily. There's Luna in the picture being held by Rowan. She says that she's worried that little girl, when she's much older, will have to take care of Rowan late in her life when Pam and her husband are gone. And she ends the letter this way, quote, "Overall, we are desperately in need of Rowan's medical assistance and would be devastated if we lost these benefits," unquote. What she's referring to there, of course, is Medicaid. And I have real trouble believing that if the Trump administration's proposal on block granting Medicaid marches forward, now that they've embraced a proposal that Republicans in Washington have embraced for years, they voted for block granting over and over and over again. Now it's a live issue. Now it's no longer just voting. Now it's an issue that could be enacted into law. And I think that would be a terrible step in the wrong direction. So, Mr. President, I think we've got to remember that when we consider these budget debates, when we consider the debate about health care, and especially when we consider real families like Pam's and real children like Rowan. And with that, I would yield the floor.